I'm Anne Mora, and every single month we've been talking about different health topics. Now this month we have HIV and AIDS because World AIDS Day was on the 1st of December. Now we're at the Nairobi Hospital, number one. Number two is we are with Miss Pheobe Jume. She's a senior registrar in internal medicine, and we're going to be talking all about HIV and AIDS from birth until, well, adulthood. Good morning.
Morning.
How are you?
I'm fine, thank you.
Okay, can we start with what is HIV and AIDS for those who don't understand?
HIV refers to infection with the HIV virus. But when you talk about AIDS, that's acquired immunodeficiency syndrome. It refers to the end of the spectrum, whereby your immunity has declined to a level where you're getting recurrent infections or certain what we call AIDS-defining illnesses or malignancies. Yeah.
Okay, so the stigma 20 years ago and the stigma now has changed drastically, which is getting better with medication and education.
Yeah.
However, let's start with birth. If I am having a child, how likely is my child going to have HIV or AIDS?
Well, it will depend on whether or not you're on treatment. Yeah. There's a risk of transmission of HIV at birth, during breastfeeding, and also during pregnancy. But that risk declines significantly if you're on treatment and the virus is suppressed. Yeah, so it will depend on your viral load, for example. Yes.
Now, if I give birth and I want to breastfeed my child, will my child contract HIV or AIDS? And what is the alternative?
Okay.
For me.
Yeah, so if you're not virally suppressed, when you breastfeed, you put your child at risk of contracting HIV. So it's important, if you want to breastfeed, you have to be on treatment and the viral load has to be suppressed. But the option that you have, there'll still be a risk of you transmitting HIV. So the option that you have is to use alternatives to breastfeeding for your baby, for example, formula feeding. Yeah.
Let's say if I have HIV and my partner does not, then, or it was a sexual encounter once upon a time, how likely is my child going to have HIV and AIDS?
I think it all depends on the mother, I think, having HIV or not. Yeah. You're saying if your partner had HIV?
Yes, or I, yes.
Or you had HIV?
Yes.
So you're still at risk if your partner had HIV and maybe you didn't have protected sex. So you just need to test. Yeah.
Now, let's get into the reality. If I'm a child and we play a lot and I graze my knee and I'm around other children, so how do we protect myself and the other children in that environment? Okay.
So you'd have to cover that cut because that's a risk. You can, if you're HIV infected and you're a child and you have an open wound, maybe you're bleeding, if that blood comes into contact with another child who has a wound, there's a risk of that infection being spread. So you'd have to, of course, take care of that wound, cover it, make sure it's not bleeding.
All right. Yeah. And then there's 37.9 million people living with HIV in Africa, roughly, and 1.6 roughly in Kenya alone. Now, when we talk about adolescents, they think that being pregnant is a lot more scarier than STDs and sometimes even HIV and AIDS. So how do you first get them to start, being protected, and number two, understanding that it is more significant than being pregnant?
I think it's maybe a matter of education, just to make sure they are aware of this risk. Maybe they are engaging in this behavior, their perception of their risk is low or something. So you'd have to engage the adolescents, talk to them and find out why they think that they are less at risk, they are more worried about pregnancy than HIV. Yeah.
Okay, so the average age is about 14 for the first sexual experience, right?
Yeah.
In Kenya, which is fairly young. Now, how do you get them to get tested, and how often should they be getting tested once they start having a sexual encounter?
At least if they're at risk, they should be at least get tested every 3 to 6 months. If you're sexually active, you're at risk. So there is no age limit with regards to testing. If you're being exposed, then you have to get tested at those regular intervals, you, yourself, and your partner.
Do you have to have parental consent when you're below the age of 18 to get tested?
As far as I know, you do not have to. Okay. You can get tested.
All right. All right, now when we get into adulthood, the world is changing. So we have same-sex marriages nowadays in various countries. Obviously in Kenya, it's not legal to have same-sex marriage. So how do you get people who are a minority in that factor to come get tested, because they are a majority of this problem?
Okay. So I think it's a sort of a public health approach is required. Yeah, they have to feel safe. They have to feel that when they're going to get tested, they're not going to be judged or they're not going to be arrested, for example. Yeah. So usually community health workers are useful. They approach the, like the homosexuals or the sex workers in the environment where they are found, and they talk to them and they maybe educate them on the importance of them getting tested, because those are what we consider key populations. They actually have a higher incidence of HIV and maybe more, more likely to spread the virus.
A lot of people are scared that they're going to be called out or caught out.
Yeah.
How do you, is there confidentiality? Because let's say if it's a married man and he had an extramarital affair, is there that confidentiality that's going to protect him or his partner?
Yeah, there's confidentiality. When you go for your HIV test, the clinician, whoever does the testing, is not allowed to tell anyone else. They have to get consent from you to divulge that information. So it's actually confidential between you and the person that is running that test. Yeah.
And if you if you have an STD, you have to tell your previous partners, right, to go get tested. If you have HIV or AIDS, do you have to contact your previous partners to get tested, or are you just?
No, it's important. It's important you should contact your previous partner so they also get tested, just like the other STDs.
Okay.
Yes.
And
important.
what's the average age you're seeing of male and female with HIV and AIDS?
Okay, I think as a clinician, I've seen all ages, even up to geriatrics. Yeah, with HIV, even 70-year-olds. So I see all ages, but majority are within the reproductive age group. That would be young girls, maybe 20 to 30 years, and young men.
Okay, yep.
Yeah, that's the majority.
Still falls into my age group.
Yeah.
Now with the geriatrics and the older, right?
Yeah.
Because they don't get pregnant, so they don't think that they have to use protection. How do you get them to understand that there's still something that can happen?
Okay, it's a bit difficult, but you see, HIV, there's that period of latency, like 10 years. Like you could get infected when you are younger, and then maybe be about up to 10 years later is when you get the symptoms. So I think it's maybe whenever you come into contact with them in a hospital setting, you just explain to them. Yeah.
And lastly, it's not a death sentence because of medication and how far we've advanced in this. If you are late diagnosed, what is your longevity of life compared to if you were earlier?
Of course, if you're diagnosed early, that's the key to the successful treatment of HIV. Those who are diagnosed early, your immunity has not declined to a certain extent, you've not gotten these severe infections or cancers, you expect it to have a life expectancy. If you take your medication well and the virus is suppressed, your life expectancy will actually approach that of an ordinary person, the average individual who does not have HIV. But if you're diagnosed late, maybe you have a malignancy, that definitely changes the picture. It's more difficult to bring your immunity back to where it was. Sometimes you never completely regain your immunity. So, yeah.
Is medication covered in our insurance?
Medication for HIV?
Yes, like the NHF.
NHIF?
Yes.
As far as I know, in the public sector, the HIV medications are provided free through the partners that we have, the national NGOs, non-governmental organizations. Yeah. I do not think it's under NHIF. NHIF doesn't cover for everything.
So then what? Because I mean, majority of people with HIV and AIDS are lower income, lower to middle income. So if I can't afford my medication...
No, but in the public sector, the medications are available free to you as an individual. Yeah, you will not have to pay anything. So it's in the private sector where you'll have to pay for your medications. Yeah.
Wow.
They're available free.
Are there different types of medication for different ages, or is just one antiviral medication?
Okay, the medications, there are various medications. So depending on your age, of course, the medications are different because of their different toxicities. So when you discuss with the clinician, they're able to know which medicines to give you based on the tests that they'll do and your age, of course.
I do have to ask, is there a cure? Or is it close? For HIV and AIDS, is there a cure?
No, there are cases that have been described, but they are rare, and the reasons why the HIV, why they were cured is not known. So there's no cure yet on the landscape, but it's an area of active research. They are constantly improving the medications. Now we have more effective drugs which are less toxic. But a cure, not yet.
But what is the average lifespan? So let's say if I, God forbid, I was diagnosed today, where you know, how long am I living till?
If you take your medications well,
Yeah.
you suppress your virus, your immunity remains good, your life expectancy should be the same as a person who is negative. Yes.
Now, I've known people who have HIV and AIDS, and they did not die from HIV and AIDS. They died from various other reasons, right? So why is it not just outfrontly said they died from HIV and AIDS? Why do they say it was malaria, or it was pneumonia, or it was this and that, the other? Why is it never just
HIV and
yes?
I think maybe they don't say it outward because of the stigma, but also because part of it is true. HIV and AIDS contributed by reducing your immunity, but in the end it's that severe infection that you get that kills you, maybe the meningitis or a severe pneumonia, yeah, or the malignancy that you got because of HIV, yeah, that kills you, yeah.
Okay.
Yeah.
I definitely think like everyone should get tested. I mean, they even self-test kits. How effective are they as well?
So the self-test kits have very good sensitivity and specificity, but they are good for screening, especially for people who are afraid of coming into contact with a healthcare facility. But should you get a positive test, you still need to do a test at a health facility.
Is it possible to get a false positive? Like, you know, in pregnancy you get a false positive. Is it possible to get a false positive here?
I think it's positive, but the tests have really been engineered, so they are really highly sensitive and specific. So it's really rare to get a false positive, but it does happen, but in very rare instances. And that's why there are several stages of testing, whereby we don't just use one test to confirm HIV. If you get a positive test, we do a different test to confirm. Yeah.
All right.
Yeah.
Definitely head down to the Nairobi Hospital to get yourself tested and checked. 3 months first, and then after that, if you have a negative, then 6 months, right?
Yes, yes.
If you have a positive, then that's when you get a second test and, of course, a diagnosis from a trained professional. Wow. Now, let's say I come to the clinic and I am diagnosed with HIV and AIDS. What's the procedure then? Do I get therapy? Is it, what happens to me?
Okay.
Yeah.
So you should get therapy. Of course, it's very devastating news when you find out that you've got this virus, and it's a lifelong infection, and you're never going to be cured of it. So you'll need a lot of information, education on the treatment, what to expect. Yeah, because this is now a lifelong illness. You'll need to be followed up. You'll have these medications you need to be taking every day on a daily basis. Yeah. So it will involve counselors, there's nutritionists, depending on your presentation. Yeah, yeah.
And what is Nairobi Hospital doing when it comes to the conversation on HIV and AIDS?
Well, the Nairobi Hospital has a clinic where we review patients who are infected with HIV. We offer testing, there's counseling, and then of course the medications are also available, all the current medications as per the guidelines. We also follow up our patients.
Thank you so much, Doctor. No, that's brilliant. Thank you so much, Dr.
Right.
Pheobe Jume. Like, I've learned a lot, I've understood a lot. I think the number one thing we need to understand is getting tested is okay.
Yes.
It should be done often.
Yeah.
Especially with high risk, right? You said high risk is multiple partners or...
Yes, yes.
Yes, I think, thank you so much. And the Nairobi Hospital is a great avenue to just start with the getting tested, and then there's many facilities as well that you can get yourself tested.
Yes.
So thank you so much
for
the conversation.
Welcome.
All right.
All right.